This video has been produced by the Women's and Men's Health Physiotherapy Department at the Oxford University Hospitals Trust. Hi, I'm Emma.
And I'm Liv, and we're part of the Women's and Men's Health Physiotherapy team. We're going to go through some information and advice regarding your recovery from gynaecological surgery. If you receive this video prior to your surgery, we advise putting the advice into practice as soon as possible.
The aims of this video are to provide advice to support post-operative recovery, to optimise bladder, bowel and pelvic floor function, and to support your return to normal activities.
First of all, we're going to talk through our early recovery advice.
We encourage you to get up and out of bed as soon as you can after surgery. To get out of bed safely and comfortably, firstly, roll onto your side. We recommend bending your knees as you roll onto your side, keeping your legs together. Then let your knees and feet drop off the edge of the bed. Finally, push yourself up with your arms into a sitting position on the edge of the bed. To get back into bed, do this in reverse. You may wish to use a wound support during these movements. We will discuss this in more detail later in this video. When resting after surgery, we recommend sitting out in a chair as much as is comfortable to optimise your breathing and circulation. At times, you may also wish to rest in lying. Place a pillow under or between your knees for comfort. Circulation exercises. After having an anaesthetic, it is important to ensure good blood circulation to reduce the risk of complications such as blood clots. The best way to do this is to wear anti-embolism support stockings and get up and move around as soon as possible. Whilst you are less mobile, try to do the following exercises every hour. Firstly, point your toes up and down 10 times on each foot. Secondly, bend and straighten your knee 10 times on each leg. And thirdly, clench and unclench your buttock cheeks 10 times. These exercises will no longer be necessary when you are up and able to move around at regular intervals. Breathing exercises. After an anaesthetic, your breathing may feel shallower than normal. Getting up and moving around as soon as possible after an operation will help you to take deep breaths, which encourages air to circulate to the bottom of your lungs. We also advise trying to take 5 to 10 deep breaths hourly. Try to fill to the bottom of your lungs by expanding your lower ribs and keeping your shoulders relaxed. Wound support. After your operation, you may also find it harder to cough effectively, but coughing is important for clearing your chest after an anaesthetic. When coughing, we advise supporting any external wounds, which can make this more comfortable. If you have an abdominal wound, place a towel, a pillow, or just your hands over the wound and press firmly as comfort allows. If you have a vaginal wound, apply a comfortable pressure over this area with your hand. These techniques can also be helpful when sneezing or laughing.
Seating. For those with vaginal wounds, you may wish to place a rolled towel under each buttock with a gap in the middle to relieve pressure off the perineum.
Next, we are going to talk about optimising your bladder and bowel function. Typical bladder function. You should aim to drink around 1.5 to 2 litres of fluid per day to keep you hydrated. Typically, you should empty your bladder between 5 and 7 times a day. You should pass urine every 2 to 4 hours, producing volumes of around 300 to 500 ml each time. Emptying your bladder once overnight is typical, but this can increase to up to 2 times per night with age. It is important that you empty your bladder well without pushing or straining. We suggest sitting and relaxing to pass urine. After you think you've finished passing urine, you can try rocking your pelvis forwards and backwards a few times, or standing up and then sitting back down again to help you fully empty your bladder. Typical bowel emptying can occur anywhere from 3 times per day to once every 3 days. However, the type of motion is often more important than the frequency. On the Bristol stool chart shown here, a type 4 stool is the ideal consistency. Type 1 and 2 stools show signs of constipation. Constipation is common after surgery due to reduced activity, disruption to your eating habits, and the influence of medication. To avoid constipation, firstly, you should aim to drink 1.5 to 2 litres of fluid per day, preferably water. And secondly, you should aim to consume a varied fibrous diet. This may be in the form of soluble fibre found in fruit and vegetables, especially those with their skin on, or insoluble fibre like grains, seeds and wholemeal products. Sometimes supplements including laxatives may also be required, and you can discuss this with your doctor or pharmacist. You should also try to empty your bowels once you get the urge to go. Holding on may delay bowel opening and can lead to constipation. When emptying, you should always avoid straining or holding your breath. This is specifically important after an operation to avoid increased pressure on the healing wound and pelvic floor. Toilet positioning. Avoid straining when emptying your bowels. This reduces pressure on the pelvic floor. Sitting correctly on the toilet can also assist in this. We advise raising your knees higher and wider than your hips by placing your feet onto a small stool. Then lean forward, keeping your back straight, and rest your elbows onto your knees. Finally, allow your tummy to fully relax. Remember to breathe throughout your bowel motion, as breath holding can increase strain on the pelvic floor. Most importantly, take your time. The more you rush, the less you relax. Now we're going to go through advice for when you leave the hospital. Leaving hospital and going home. To increase your comfort, we advise wearing loose clothing after your surgery. When getting into the car, turn your back towards the car seat, then slowly lower to sit down onto the seat. Then move one leg at a time, using small steps to pivot around into the car. Your hand can be placed over any wounds for support. To get out of the car, do this in reverse. If you have an abdominal wound, you may wish to place padding or a rolled up towel between the wound and the seatbelt for added comfort in sitting. You may also benefit from taking regular breaks if you have a long trip home.
Now we will talk through our general advice surrounding returning to everyday tasks and activities.
At home and returning to normal activity. Due to wound discomfort after surgery, you might find yourself stooping when sitting or standing. This can subsequently impact the comfort of your back, the healing of your wound, and your bowel function. A comfortable chair with a good back support can help this, as well as consciously trying to stand up tall when you're walking. When using the stairs, we advise taking this slowly, one step at a time, using a banister for support if you have one. When bathing or showering, avoid using soaps as they may irritate your wounds. When drying, pat gently with a towel rather than rubbing to avoid any skin soreness. You should try to be active little and often, but remember rest is also important for your recovery. You may find that you become tired more quickly than prior to your surgery. Try to exercise within your limits, being mindful to pace yourself. Returning to normal activity. Initially after your operation, regular walks are encouraged, as much as energy and pain allows. However, certain tasks may be more difficult. We suggest avoiding everyday tasks involving twisting or lifting anything heavier than a kettle, including small children, for up to 6 weeks after surgery. After 6 weeks, gradually reintroduce these as comfort allows. Your return to work will depend on the specific tasks you need to do and your overall comfort. You may be given specific advice surrounding a phased return by your medical team or employer. To return to driving, you must be able to comfortably and safely complete an emergency stop. Most patients find this is around 6 weeks after their operation. However, it could be longer. We advise that you check your insurance cover before restarting to drive. Returning to sexual intercourse will depend on the type of surgery you have had. For any surgery involving vaginal stitches, we advise waiting at least 6 weeks before returning to intercourse to avoid irritating the stitches and to reduce the risk of infection. However, it can take up to 12 weeks for stitches to fully dissolve. Before this point, the stitches may therefore be felt during intercourse by you or your partner. For other types of surgery, you can return to intercourse once you feel comfortable and ready. If you have any concerns, you can discuss this individually with your doctor. Now we will talk through our general advice surrounding returning to exercise. During the first 6 weeks, we encourage you to gradually build up your walking tolerance, which will depend on your comfort and general fatigue. For patients with dogs, we advise asking someone else to hold their lead for the first 6 weeks to avoid any discomfort caused by pulling. In this first 6 weeks, we also suggest you begin completing some general strengthening exercises for your pelvic floor and deep abdominal muscles. We will discuss these exercises in more detail shortly in this video. From 6 weeks, you can gradually return to activity. We advise starting with low impact activities such as Pilates and yoga, and once any wounds are fully healed, you can also return to swimming. You can then gradually return to impact activities such as running. Just be mindful to pace yourself and reduce the activity if any discomfort or increased fatigue is experienced. To support a graded return, we recommend using the NHS-approved Couch to 5K app. Deep abdominal strengthening exercises. As we previously discussed, we encourage a focus on strengthening your abdominal muscles after surgery. These muscles can weaken due to a change in your general activity levels or if pain is experienced. The abdomen consists of various layers of muscles which all work together to provide strength and control around the pelvis and the spine. Ensuring you have the correct technique is essential. We are now going to discuss and demonstrate how to effectively contract your deep abdominal muscles. In lying or sitting, place your hand in the space below your belly button. Start by fully relaxing your tummy. Then slowly take a breath in. As you breathe out, gently draw your lower tummy inwards. Imagine you are drawing your belly button towards your spine. Try and hold this for 5 to 10 seconds, but keep breathing normally. Then relax, feeling your tummy let go. Repeat 5 to 10 times and aim to repeat up to 3 times a day. Once you are comfortable with the technique, you can complete this exercise in standing. When able and confident, we would then encourage you to also carry out this exercise whilst completing normal everyday tasks. This involves contracting your deep abdominal muscles during activities where the pressure in your abdomen is increased and you therefore require more support.
For example, try to engage these muscles before standing from sitting or before lifting and carrying when you have reintroduced these activities. This aims to promote the recovery of these muscles.
The pelvic floor muscles help to maintain continence, support the pelvic organs, and assist in sexual response. Strengthening them by completing exercises is something we should all do every day. It is especially important before and after surgery when the strength of these muscles may be affected. We highly recommend you review our dedicated video explaining how to complete these exercises and how to establish an appropriate program. This video can be found on our YouTube channel under the title The Pelvic Floor Muscles, Developing an Exercise Programme. Please note, you may have a catheter in place after your surgery. Please wait until the catheter has been removed before commencing pelvic floor exercises. During this video, we have discussed advice surrounding early recovery, getting home, returning to normal function, returning to normal activity, abdominal strengthening exercises, and pelvic floor strengthening exercises.
We now ask that you take the information and exercises from this video and the accompanying video on pelvic floor muscle strengthening exercises and establish a routine that works for you.
Thank you for watching this video. If you have any further questions or concerns, you can contact the department via telephone on 01865 235 383 or via our email address